much for joining us today. Welcome to our webinar. Today we're having an exciting conversation, a critical conversation in our space, the advocacy space. This is the second part of a three-part series on funding and the practice of advocacy in Africa. Today we're looking at sustainability. We're looking at building resilience in advocacy, exploring philanthropy in Africa as an alternative funding base. Last year, we started our conversation on just the general landscape of funding, especially the impact of COVID-19, and the discussions were varied, the discussions were interesting, and right now we're looking at solutions to advance and continue the practice of advocacy in Africa. My name is Irene Alenga. I'm the Knowledge Management and Community Engagement Lead at, I'm happy to be with you for the next 90 minutes. For now, I would like to beg for your patience as we wait for more participants to join us. In the meantime, I would like to request you to please type in your name, the organization you come from, and the country which you are hailing from as we wait for the rest to come in. Welcome. We'll start shortly. Good morning from wherever it is you're joining us. Welcome to today's conversation on funding and the practice of advocacy. This is the second part of a three-part webinar series that looks at the funding landscape within the continent. Last year, we had a conversation about the current situation given the COVID-19 impact and the insights and the innovation ability, and we are particularly looking at building resilience in advocacy, exploring philanthropy in Africa as a alternative funding base. So In the next 90 minutes, we shall be having interesting conversations about this. We have a very great set of panelists who are going to be addressing this issue. But before we start, would like for us to be on the same page as regards how we are going to operate within the next 90 minutes. So our webinar norms are pretty simple. We're aware of the type of investment that each and every one of you has made in terms of time, ensuring that you have connectivity and the infrastructure to be able to attend this 90-minute webinar. So we respect your time and availability in the view of COVID-19 uncertainties. We would like to request you to type in your questions and comments in the question and answer box, and we promise that we'll save enough time at the end to be able to address these questions that you will be having. Our panelists will use their videos and microphones. All of you are on mute. We'd like to ask that if you wish to speak or ask a question live, raise your hand and we'll be able to unmute your microphone so that you can speak. Let's respect each other's opinions, and we're very aware that we're all knowers and keepers of information, so it is important for us to actually note that and be respectful of the comments and suggestions that will come through. Our hashtag for today is strong advocacy. We'd like to welcome you to use it as in the comments that you have for today's social media channels. So we serve French-speaking and English-speaking African countries, and we've been able to offer simultaneous translation during the next 90 minutes. Branley and Margaret will be on the French channel. In order for you to be able to access this, you're requested to select your language of choice in the language interpretation icon at the bottom of your Zoom screen. It's a global map. Just click on that and mute the original language in order for you to have a good experience throughout the 90 minutes. Please stick to that language and only speak in that language during the meeting. As I said before, our presenters and speakers are requested to only use video when speaking and to turn their microphones only when presenting. Otherwise, please mute. We have an interesting agenda for today. We're going to have welcoming remarks. Then we're going to have a panel discussion that's going to be led by Bheki Moyo, and the organizations that are going to share their experience and wisdom today for our Kenya Community Development Foundation, Trust Africa, and Aspire Coronation Trust's Foundation from Nigeria. We're then going to have discussions where we're going to invite your questions as suggestions and comments. And after that, we'll have a live poll and our closing remarks. As I said before, my name is Irene Alenga. I am the Knowledge Management and Community Engagement Lead at the Advocacy Accelerator, and I'm very excited to have you here with us today. Please, we're looking for candid conversations which are going to be solution-oriented in the advocacy space at this particular moment. So you're welcome to actually give comments and suggestions on this. Be free to give your comment and suggestions. These are critical discussions, and we look to disrupt the space in which we are at so that we can advance advocacy within the continent. I would like to introduce to you our Deputy Executive Director. Her name is Claire Mathonsi. She's an African feminist with extensive experience in women's rights and gender equality in the global context, with direct experience across Asia, Anglophone and Francophone Africa, Eastern Europe and Latin America and the Caribbean. Throughout her career, she has worked in diverse sectors at national, regional, and at the global level. She has comprehensive insight and practical exposure across gender in the context of sexual rights and health rights, HIV, governance, economic transformation, and all forms of gender-based violence, and its linkages to key issues related to gender equality. She is the chairperson of Access Chapter 2, an organization in South Africa, the vice chairperson of Akina Mama Africa in Uganda, and the Vice Chairman of Make Every Woman Count in Guinea, and a board member of the 1 in 9 campaign in South Africa. I would like to welcome Claire to give us welcoming remarks for our meeting today. Claire?
Good afternoon. Thank you, Irene. Good afternoon, good morning, and good evening to all who have joined the call. We're delighted to be able to host you in our advocacy series. Welcome to the Accelerator's webinar series called Funding of the Practice of Advocacy, with a focus on exploring philanthropy in Africa as an alternative funding base. This is our second webinar in our webinar series, as Irene has shared, and we look forward to giving an additional dimension to the issue of funding of advocacy in Africa. Firstly, to explain who the Advocacy Accelerator is. The mission of the Advocacy Accelerator is to strengthen advocacy capacity, alignment, and impact in Africa by providing spaces online and in person for advocates and the networks that sustain them to share evidence, approaches, and expertise. Its vision is a world where strong, coordinated, country-based advocacy is a driving force for improvements in health and development. The accelerator exists to disrupt traditional models of development work and build an inclusive advocacy ecosystem that values peer-to-peer learning and local knowledge from the African experience. The accelerator is consciously African-centric, leveraging technology to build vibrant advocacy communities across the continent. The core service offering of the accelerator is connecting advocates, donors, technical assistance providers, and other stakeholders in the advocacy ecosystem to spaces where they can access knowledge, tackle challenges, co-design solutions, and contribute and share high-quality, field-tested resources for more impactful, locally driven advocacy. The organization also looks at sector strengthening and approaches and contributes to advocacy coalitions and partnership strengthening. The webinar series is based on the need to explore the full resourcing of advocacy and the solutions around dwindling funding for advocacy on the continent in a context where we have extremely difficult political conditions, which puts a strain on those involved in the agenda of change in their countries and in their communities. There is a general belief that advocacy funding comes from the West, which silences and invisibilizes, if you will, the important role and contribution made by African philanthropic organizations. We believe that African philanthropic organizations contribute to the resilience of what advocacy organizations, networks, and individuals can be and become, and therefore by creating a platform focused on this topic, we aim to contribute to the critical role that the sector has played and continues to play in the funding of advocacy. In light of COVID and the additional disruption, or rather the exacerbated issues caused by COVID to the advocacy sector, we are excited to engage in conversations around resilience and support for the advocacy sector. There needs to be a better understanding of African philanthropic organizations, which we hope will lead to greater support of these entities because they are extremely critical. We have a great panel today, and I'm delighted to introduce the moderator who will facilitate the panel, Dr. Bheki Moyo. Dr. Bheki Moyo will introduce the panel. My role is to introduce him. Bheki is a writer, researcher, and thought leader who has championed the African discourse on philanthropy and contributed to the growth of many African civil society formations, and has taken part in most of the continental processes of development and governance. He has gained considerable experience in management, leadership, and strategic roles over a significant period. I will stop there and say welcome, Bheki, and over to you.
Okay, thank you very much, Claire. Thank you very much, Irene, for the opportunity to have this conversation. As I've been introduced, my name is Bheki Moyo. I currently head the Center on African Philanthropy and Social Investment at the Wits Business School in Johannesburg, South Africa. Part of what we do is to track trends and developments in the field of philanthropy and social investment. And of course, given the impact that COVID has had on several sectors of our lives, one of the areas that we've been tracking is the response to COVID by philanthropic institutions, non-profit actors, as well as the private sector. And I think that there are so many areas to look at and discuss, but today's panel is going to focus on one of the key areas that seems to have been impacted upon by COVID. And that's the area of funding, generally to the non-profit sector, but in particular to advocates and advocacy in Africa. I think that those of you that have seen some of the latest reports that started coming out as early as June 20 of 2020, a lot of trends began to emerge. And one of those was that a lot of institutions were affected negatively in terms of funding. Donors had to think differently as a result to COVID. So the majority of donors decided that they were going to reallocate most of their funding towards COVID-specific activities. And that left a lot of other organizations that did not have any programs on COVID, almost without any funding at all. And this resulted in a lot of groups thinking that they may not survive beyond the period in which this donor funding has been reallocated. And of course, the other is that when you lose funding at that critical moment, your operations have to change and direction has to be rethought. And we saw a lot of groups, changing their operations, scaling down. Others definitely, because they were never prepared for a world where they had to pivot to online systems and platforms. They were kind of, in many ways dysfunctional for a number of months. They only began to be effective after a couple of months. So overall, basically the issue is that donors had to focus on that which they thought was urgent, and this had to do with the medical response to COVID-19. Very few organizations or donors increased their funding during this period. So we do have a few groups of donors that decided this was the time to actually give more, become flexible. But overall, the majority of our civil society organizations and advocates reported that they were affected negatively. You can look at the reports that were done by EPIC Africa, the reports that were done by Civicus, the report that was done by the Advocacy Accelerator as well. And you'll find that there are staggering figures there that show the extent to which civil society and advocates were affected. So today we want to look at the possibility of African philanthropy or African sources of funding to be the place to go to in order to continue the work that civil society and advocates are doing. We want to try and see if during this panel, we can get to understand and get insights into the future trends of financing advocacy in Africa in a world that has been characterized by COVID-19 and beyond. We also want to get insights into the sustainable Afrocentric options for funding that we can use to continue the practice of advocacy. And finally, I think if we do have time to get a sense of how philanthropy in Africa presents itself and its dynamics within the advocacy space. It is my pleasure now to welcome the panelists that are going to help us discuss this this topic. We have Janet Mawiyoo, who is the current director of the Kenya Community Development Foundation, based in Nairobi. Those of you that have worked closely with Janet, you would know the passion that she has for community development. Janet has over 30 years experience working in the non-profit sector. She's an expert in building development and philanthropic institutions, and I think her time at KCDF is testament to the work that she has done. She has led the organization through different epochs to a point where they've put in place initiatives that will contribute to the sustainability of the organization. So welcome, Janet. I think you can also read a bio. I'm sure it will be circulated. We also have Briggs Bomba. Briggs is with Trust Africa, based in Senegal, Dakar. He's the programs director. Trust Africa, those of you that know it, is a Pan-African foundation that works across the African continent, promoting democratic governance and equitable development. Briggs is part of the senior management team. He provides the strategic leadership to the programs team and oversees a diverse portfolio of programs and initiatives that are spanning several African countries. Briggs is also very active in Zimbabwe, where he is the convener of the citizens' initiatives. And I'm sure some of the questions that have already been posted, Briggs will use that experience from the Zimbabwean perspective. He is the founder of Zim Alliance, which works now to convene the citizens' initiative. And then finally, we will have Ndifreke, who is the Director of Programs and Grants at the Aspire Coronation Trust Foundation. She is the seasoned development expert with over 15 years experience in the social sector, with strength in entrepreneurship and leadership development, as well as in health initiatives. I think I'll stop there in terms of introducing the panel to save time, but their bios will be available. I'm sure the organizers will share those with you. So we'll get straight to the opening remarks. So COVID-19 started as a medical challenge, and it confronted humanity across the world, but its effects soon touched every facet of life. In the nonprofit sector, as I said, funding was and remains one of the main areas that was affected by COVID-19. Different donors reacted differently to COVID-19, with some adopting conservative measures, while others became more flexible and even provided more funding to their partners. On the other end, civil society organizations in Africa reported being negatively affected by COVID-19 to the extent that some closed operations, while others pivoted to online platforms and other initiatives. All three of you have, you provide grants and funding to some extent. Can you each describe how you were affected by COVID-19 and how in return you responded? What have you learned so far? We'll start with Briggs Bomba from Trust Africa. If you could take up to 10 minutes just responding to that question and any other point you might want to talk about. We'll then get back to the discussion time where I'll ask you pointed questions specific to Trust Africa. Briggs, over to you. Hi, Briggs.
Thank you, Bheki. I'm operating the technology here. I'll turn on my video for just a second. It's not very good lighting, and I also don't want to risk the connectivity here, but so that colleagues can just connect for a second. If you don't mind, I would like to just go back to the audio and respond to the questions that you've posed.
Please go ahead.
Yes. Here we go. Yeah, so thanks very much for the opportunity and for the introduction. I think it's important for us to begin by, sharing our sense and understanding of philanthropy. From Trust Africa, this is synonymous with solidarity or sharing. And in some ways, we referred to it as the love of humanity. And this is something that we see to be integral to the DNA of most African communities. Where we are based in Senegal, if someone says, if you give something to someone and they say thank you, the reply in Wolof is Nyokobok, which means that it is your share of what is in my possession. So it is a philosophy indeed, and a resource that Africans have always been tapping into in times of need. And we think that it can be central in driving our advocacy agendas. We see philanthropy as being underpinned by a notion of from each according to their capacity and to each according to their need, meaning that everyone can contribute from a few pennies to millions of dollars or rands or US or whichever currency you can think of. And in the COVID era, we have seen African philanthropy in operation. I think as early as April, those who followed in Addis, you saw over $3 million euro contribution from one of African philanthropists to the city of Addis, as early injection in the fight against COVID. In Zimbabwe, we saw groups like Higher Life Foundation being at the center of rescuing a public health system that had collapsed. So paying nurses, doctors, providing transport, communication, providing PPEs. So we've really seen a philanthropy to be at the center of the response that that we have seen during the COVID period. And more direct to your question, when you say how were we affected, I would say as Trust Africa, it was in several ways. I think we were affected in terms of how we operate our operations. We were affected in terms of the flow of our funding, and we're also affected in terms of what we prioritize, the issues that we were working on, the agenda that we're working on. And we're also significantly impacted in terms of our actual thinking about resources. And I think in terms of how we operate, like most organizations, given the need for physical distancing and the lockdowns that were effected in several countries, we also had to resort to virtual platforms for our organizational meetings, as well as our interactions with grantees, with partners, with with stakeholders. And I think for us, it wasn't a huge leap, because we already had been experimenting for several years with remote working setups. So we had the technology in place, we had the facilities in place. So it wasn't very much, a huge leap, but it was still something that, we had to jump on. But I think most significant for us was how our agenda was impacted. Trust Africa's mission is to work to solve the most pressing challenges, developmental challenges for the continent. So it's a mission that by design, pushes us or challenges us to respond to what emerges as the most pressing matter then. We are not, cast in stone to say our question is saving polar bears. So whatever happens around us, that's what we focus on. We respond, we are primed to respond to what becomes the most critical challenge. And in this particular context, our agenda was really shaped in the sense that the question of domestic resource mobilization became much more critical than we had been talking about it, because what we quickly saw was how all systems, you know, political, you know, health systems, economic systems, you know, social safety net systems were quickly stretched to the limit. And we could see that the reliance on external resources, you know, was basically, you know, not going to be a solution, because we're starting to see that reprioritization of resources back to their, you know, usual global north sources. So we began to emphasize a lot more the question of domestic resource mobilization as the basis for development finance, you know, in African countries. But secondly, the question of global inequality was amplified for us. And I think we continue to see it now when people have started to use language like, you know, vaccine apartheid or vaccine nationalism, where you see every country completely focusing on themselves and without this sense of a global community. So that also quickly became a part of our advocacy, you know, including through a platform we launched called the Community Immunity, where we are saying, you know, no part of the world will be safe until all of us adopt a global community approach and everyone is safe, and until we pay attention to those who are on the margins of society. And the question of public health advocacy became critical for us in terms of our own investments, in terms of the issues that we're working on. And most significantly, we also quickly saw the fragility of human rights protection mechanisms and frameworks on the continent, because whilst we're dealing with a, you know, global health pandemic, the securitized approach to enforcing lockdowns, to, you know, the state of emergencies that were declared, the curfews, quickly became a human rights issue. I think those who were tracking with, even in South Africa, in Kenya, you know, Zimbabwe, the numbers of people who were arrested for, you know, so-called lockdown violations were astronomical and completely dwarfed the numbers of people who were being reached in terms of, you know, the support that were given. So human rights advocacy and support for us became also very critical. And what you were seeing is when state of emergencies were being declared, you know, in most countries, parliament would be suspended, the judiciary would be suspended. So you only ended up with the executive operating. So we supported advocates that started to speak of the need to ensure that you continue to have all arms of the state operational, so that you can have checks and balances. Even parliamentary health committees that should have been, you know, in the front line of responding to these issues, their operations were also suspended, leaving completely unchecked power in the executive. So for us, a human rights advocacy agenda became very, very critical. And I think the last thing I can mention there in terms of the agenda for us was really the question of tracking the use of public resources and ensuring accountability in the use of public resources. We were seeing, you know, so many pledges being made, and in some cases, you know, real contributions coming through, running into millions of dollars to support this fight. But, you know, the cases that started to go out in terms of the abuse of public resources and the abuse of resources that were meant, you know, for COVID supplies, you know, were just, you know, all over the place. So that became also a critical part of our advocacy agenda. And I think I should also mention that, you know, the way that our funding flows, and this is the third way that we're really affected, which is really in terms of, you know, funding flows. When COVID hit, we were in the middle of, you know, in some cases, very advanced, you know, engagements with funding partners in terms of, you know, grants. And we started to see a situation where resources were being reprioritized to deal with a domestic health emergency. And in some cases, we actually had, you know, very progressive, you know, back donors of ours recalling at least 50% of their funds so that they could focus on their own domestic priorities. And I think this was quite interesting because you had seen most philanthropic organizations signing the philanthropy pledge that committed to allowing budget modifications, allowing unrestricted funding, even allowing increased funding. But I think in practice, what we actually saw happening was the opposite of that. So in summary, Bheki, we were affected in how we work. We were affected in terms of the issues that we were prioritizing our agenda. We were affected in terms of the flow of resources that were coming in and going out. And we've responded to this in several ways. One of the ways for us was to resort to grassroots fundraising in a manner that we have not done before. So we launched, a massive grassroots fundraising appeal. We also responded by collaborative fundraising. Trust Africa, African Philanthropy Network, Southern Africa Trust. Those are the partners that collaborated in launching Community Immunity, which has been successful in raising resources that has enabled us to bring attention to those who are on the margins of the equation. And also through that Community Immunity initiative, we also ramped up advocates through what we're calling Livestream for Africa. We brought in people like Yvonne Chaka Chaka, Berita, Baba Mal, big icons on the arts and cultural scene on the continent to be ambassadors and to raise, again, attention to, the groups that are most vulnerable. And, we were citing them. These were your daily wage earners who could not survive 30-day, lockdowns. It was your farmers. It was, people who relied on going to the markets, who were suffering a double tragedy in a sense. And I think another way that I could also cite is...
So Briggs, we'll come back to some of these issues. You're already touching on some of the other questions that I think we'll get back to. So if you don't mind, we can stop here for now and move on to Janet. But yeah, thanks. But a lot of what you've just raised is very fascinating. We could go on and on. I mean, one of the key areas that I would want us to try and get back to is this alignment between the behavior of vaccine nationalism and the measures that countries had adopted early on in the beginning in order to combat COVID-19. As you would know, almost all countries looked inwards, and it's not surprising that even when it comes to the issue of vaccines, countries are also looking inwards, forgetting that people move and the virus cannot be stopped by borders. And then the second is the whole issue around focusing on domestic resource mobilization, which I think is partly one of the key big questions that we have not been able to unpack as civil society organizations. So let's move to Janet. Janet, if you could respond to the same question, if you could take about 10 minutes. Basically, how were you affected and what have you learned?
Thank you, Bheki, and thank you for the chance to be part of this very important conversation. Yeah, KCDF, which is running this year to its 24th year or thereabout, we were just hit in the same way that Briggs described, like everyone else. We make grants, we push a very bottom-up approach right from, over the years. We've tried to push for, what we call sustainable development that is community-driven. And of course, when things went really south after COVID hit everyone, we quickly reached out to our partners and tried to understand what was really happening on the ground. And for me, thinking back about this whole situation, I think the one thing that has stood out is the importance of having having relationships. Sorry, I'd forgotten about my camera. Having relationships, having connections, because at a time of a crisis, you can't go to people you don't know. And so when this whole situation happened, of course, we reached out to our very frontline people who are the grantees we work with and tried to understand what was happening. And by establishing the situation they were in and how they were affected, how they were coping, that collection of information became our basis for reaching out to the rest of the stakeholders we have locally and internationally. Because it's true, livelihoods were badly hit across the board. And just understanding the needs on the ground became the basis for riding on to inform the people fund our work locally and internationally. And it became the avenue for raising, resources to support and to respond to the crisis. And I think that for me has really stood out as a very important thing, because we often will complain or say there isn't local resources or people are not well off or whatever, but actually a lot depends on the relationships that you've built over time. And we've realized that is at the center of succeeding to raise money for whatever it is you're doing. Of course, as Briggs has explained, I don't want to go back to that. There are those who agree to make adjustments, or we actually had a couple of funders who also agreed to provide maybe additional or some specific resources to support the work. But more important, I think, is just the way locally, as it became clear what was going on, a lot of actors, individuals, of course, at a community level, at a very household level, there was that Ubuntuism, let me say that, where people really tried to be supportive of each other. And that, for me, from an organization perspective, has really helped me realize the importance of communication. The basis, of course, of communication is the facts that you have. So the data you collect makes it possible for you to explain what is happening. And the relationships you have built makes it possible for you to help others see how to support you. So for me, that has been very core. And at a lower level, because we really push the idea of groups, ordinary communities also being able to ride on the trust that they have created themselves, we saw a lot of that also happening. The community organizations being a basis for reaching out for education, for people just seeing who is really badly off, who is really at the verge of collapsing. And I really appreciated a lot of community groups and the grassroots actors or were not able to move out of their houses, or whatever it is that is happening. So the role of grassroots organizations, I think, became extremely central in communicating, in helping point out our needs, which then became a vehicle for raising local resources around the community groups. So the issue of how are we able to respond is at the grassroots level. For us at a national level, I think we have seen those kind of responses happening. And but the other bit is when resources were scarce, of course, you go back to, what do you have? Do you have savings? Do you have anything? And to push us to really have those deep sustainability conversations around how do you respond? What do you have? What do you have in your hand which can be leveraged to help organize ourselves going forward so that we are better able to deal with emergencies. I guess sometimes when you live well or you live from hand to mouth, you don't realize something can be of this magnitude. But I think are we doing with the grassroots organizations, with ourselves in terms of creating frameworks that can allow these organizations, because we have seen this can actually happen as it did happen. I don't want to, Bheki, I assume it's possible to pause now before I go into what else did we do? Is that okay?
Yeah, that's fine, Janet. I was checking with Irene whether it's my internet or yours. I kept losing a bit of what you were saying, but I think we got to understand some of the issues that we are talking about. So we can move to Ndifreke and also try and respond to the same question from the perspective of ACT, but also I'm sure there's the West African dimension to how you are affected. Ndifreke?
Good morning, everyone from Nigeria, and good afternoon to, good evening to other people in other parts of the world. Thank you so much for giving us the opportunity to share on this very important topic. So COVID-19 affected our foundation, and our foundation is a grant-making organization. We are Pan-African, we're very young. So when I was hearing Janet say the 24 years, I was like, oh my gosh, they're going to get there soon as well. We've been in existence for about 4 years now. We're going to be 4 years this February. And being that our foundation is young, we started our funding to a lot of organizations in Nigeria, and we have steadily grown outside of Nigeria. We're funded not-for-profits and initiatives across about 7 African countries so far. And we hope to do a lot more. So as an organization, our foundation was affected as most businesses and civil society organizations were affected. And when we usually would announce the grantees for the year about March of every year, March, April of every year. And we had done all our selection, had all the interviews, and decided on the organizations we were going to fund. And we had over a certain the number that we had planned to fund for the year. And then the lockdown happened, and everything had to change. So we had to quickly go back to the drawing table and begin to look again at what we had, who we had selected. And we realized that we couldn't take that decision ourselves. So we had to engage our grantees to say, what are the next steps? What do you intend to do given everything that was happening around us? It took us another month or so to kind of settle into who could fit into the new system that we found ourselves. A lot of nonprofit initiatives are very physical, where interventions have to be done physically a lot of the time. So more than 90% of the people we selected were going to do physical intervention. So we had to quickly think about how do we do this? How do we change this narrative? How do we find the right organizations so that they do not put their lives at risk and put the lives of their beneficiaries at risk as well? So we had to have conversations. That was the first step for us. We strategized it. And even at that point, it was a difficult conversation because we realized that for some organizations, they had planned their budget for the year based on the funding that they were expecting from the foundation because maybe they were past grantees of the foundation. So during those conversations, we realized that the very first thing was the ability to adapt quickly. We didn't have much time. We didn't want to not fund the organization because that was another option that we had. Should we hold off and see what happens? Because nobody knew this would take us a year. Even at the end of 2020, I'm sure a lot of us felt, oh, by 2021, it would be a different story. But here we are with the second wave and trying to deal with it. So for us as an organization, we had to start looking at the adaptability, right, of organizations to be able to transition quickly into reaching their beneficiaries and reaching their target audience without putting themselves or their families at risk, and also with the restrictions of the lockdown, that we experienced. So that was really the first step for us when COVID-19 hit. We had to start thinking outside the box, and we had to get our organizations to think outside the box as well and adapt quickly. Another thing that was interesting to us during that period was the fact that we realized that even with the organizations that we had selected, as they began to implement, we realized that we needed to be flexible, right? We could not have the same expectations or high expectations that we had of them in the past years, because now they were learning as they were going along. So we required some level of flexibility on our end, and we had to do a lot of touching base and finding out what sort of support they required. What could we do for them? How could we help them to take on this big project that we decided on, that we're going to do this and we're going to do it differently. Another thing that we found that was challenging for now our partners, because we do not implement, so whatever the work our partners do for us is success to us as an organization. We had to start looking at the use of technology. Became an area that we had to take note of. As I said before, a lot of nonprofits are used to physical interventions, and we needed to start, even those that had decided to transition and had the capability to transition, now had the challenge of their beneficiaries not having access to technology tools to help them benefit from the interventions. The closure of schools, government restrictions on different things, it affected the work that our grantees were going to do. And as we kept having conversations with them, we kept hearing things like mental health, being able to cope, being locked in, and we realized that you're not just dealing with organizations, you're dealing with people. And the same thing that we were experiencing in our personal lives and affecting our own lives was also affecting the people that we work with, right? And so we needed to start providing support in terms of how do we have these conversations so people realize that it's not the end of the world. So we had a lot of conversations with our partners and stretched it a bit to organizations within the social sector as well. So we had to do a lot more trainings, in terms of capacity building on technology, on mental health, and those sort of interventions. And so given all the feedback we were receiving, we knew that we needed to find out a bit more and understand the space a bit more, given the COVID-19 and the effect of COVID-19 on the sector. So we launched the research ourselves to find out a bit more on the impact of this COVID-19 on social sector organizations from a funder's perspective, so we could better understand how to support the organizations we're working with. And we got some very interesting feedback. I think that was very interesting to us. We found that a lot of nonprofits that were still in business, or that were still able to implement and didn't have to lay off staff, or shut down some of their operations, and those that had reserves to tap into, right? Those that had reserves, right? And that was very interesting to us, because you hear a lot of people say, oh, nonprofit, you need to be sustainable, you need to have a sustainability plan, but we didn't realize how much that meant for an organization as like for nonprofits to actually take the next step in a situation like COVID. So that was very interesting for us. We also found that 16% of organizations, only 16% out of the 446 organizations that responded to that research were able to get funding from new donors. And that a lot of the others that were able to get funding was because they already had relationships with certain donors, and they were able to build on that because of their credibility and their ability to adapt. Another thing we realized was that staff productivity was highly reduced. Over 70% of the organization said staff productivity was very reduced. So they were struggling to actually deliver because staff being locked down at home were not giving as much, and they were having, and we found that the culprit to that was internet access that was contributing to reducing staff productivity, right? So we began to see that this wasn't something that was just happening in Nigeria. This is something that was going on across the continent. and that we had to start thinking about how best do we support organizations to ensure that at the end of the day, they achieve their mission so we can achieve our mission as well. And we couldn't think about it just from an organizational perspective. We have to think about it from a personal perspective as well, because we do not want a situation where organizations became the beneficiaries rather than the people who were providing the service. We were very fortunate because we're an indigenous grant-making organization. We've built some credibility over the few years that we've been in existence. We started getting a lot of requests and having partnership conversations where people were, particularly with the international community, who were not able to be on ground anymore, but now had to return to their home countries, but still wanting to do some work and wanting to partner with organizations that were on ground in the country. So we began to have a number of those conversations where people wanted to know how they could work with us. We're able to partner with Novartis last year to provide personal protective equipment to hospitals and clinics here in Nigeria across a number of states. And that we found that really interesting, which meant that if we as funders prepared ourselves well enough, those sort of opportunities will come where we can support more civil society organizations and nonprofit organizations. Another thing that we found was that we needed to be creative. We needed to be creative and also help our people be creative. So we had to do a lot of support to ensure that they are able to actually transition right into the use of technology and transition effectively. And we know across every part of the world that internet connection now is like having fun, it's like having money, right? So we are thinking about how we can improve on all of that. And I think it was a learning experience for us. We had the opportunity to run a Changemakers Innovation Challenge in 2019 for the first time. And the reason we had that, I'm rounding up now, the reason we had that challenge, because we realized that we were funding a lot of organizations that were implementing physical intervention and very useful, very impactful. But we realized that if they were able to utilize or leverage technology, they could reach much more people. So we wanted to find organizations that were already leveraging technology across Africa to implement projects or reach their beneficiaries, to then celebrate them and give them extra funding from our typical grant cycle so they could do more. And that way, other people could see how technology could add value. And I think that was a sight into the future for us because we knew it was possible. And so with 2020 and the lockdown, we realized that more organizations needed to transition. So it had its good part of forcing all of us to realize that technology is the way to go if we want to make the sort of impact we want. Nigeria has over 200 million people. Imagine impacting just 1 million people, right? That's a drop in the ocean. We want to be able to do more, and we know that technology can get us to that next level. So those are just a few things learnings that we had from 2020 and from some of the experiences that we had as an organization as well.
Thank you very much, Ndifreke. So when we come back to you, there's somebody who has already said it's interesting to hear how you speak on the role of sustainability and reserve funds and the role that they play in the resilience of the nonprofit sector. I think when we come back to you, it would be useful for you to talk a bit to how African philanthropists, whether or not they are ready and able to support such initiatives. In fact, I think what we see currently is, a lot of responses are mainly to emergencies, but not to long-term, development outcomes. And so we'll come back to you. This is the time now for the discussions. And so I do have a couple of questions that were collected from the registration. But if you do have questions now, you can either type in or you can raise your hand and we'll be able to recognize you. So let's go back to Janet while we're waiting for people to type in their questions. Janet, you work mainly at the interface between communities and donors of different types. You did speak a bit about the impact that COVID had in general, but also for advocacy. If possible, could you talk to how your foundation supports advocacy work, and what are the alternative sources we could start looking into to support advocacy and other developmental initiatives in Africa? I think you are best suited to speak a bit about your experience raising resources from alternative sources. And I think that's, the conversation is really leading us to saying, what are the alternative domestic sources that we can draw on to support advocacy in Africa? And of course, there's a role that foundations like yourselves play in this. And so I would want you to pull your thoughts together and talk to us about that. Janet.
Yeah, thanks, Becky. KCDF being a very grassroots oriented organization, we don't describe ourselves as an advocacy organization as such, but we do support advocacy work very often, building on the belief that it is very important that people themselves understand how they go to the challenges they are experiencing, what is going on, what are the issues, what can be done. And through the grants that we make to them, to the different CBOs and NGOs, supporting that strand of work that allows them to understand the policies that are affecting them, the situation they are in, helping them to get to the table. And of course, in Kenya, we have a devolved government kind of structure. So it is possible for grassroots organizations to make their voice heard at county level. And so our major approach from that perspective has been to indirectly support advocacy through the support that we give to various groups to advocate for the issues that are affecting them. Some might be specific to certain groups, it could be children, could be people, with epilepsy, or, certain groups that have certain challenges that need to be brought to the attention of policymakers and etc. So one of the ways that we support that kind of work is doing it indirectly through the grants that we make, but more important, building the capacity of those organizations to be able to bring the communities on board, to see the opportunities that are open to them, so that they can ride on that to influence what's happening. How can they influence the resource allocation, for example, for service delivery to happen? And sometimes supporting them to mobilize resources and ride on that to push government. I mean, one example that has never left my head was witnessing one of the groups in Maasai Land, or not the others. This is an area that is close to Masai Mara, one of our big wildlife areas, and the communities managed to mobilize whatever they had. As Briggs described, it is what you have. I really liked the word he used, nyoko boko. It's my way of sharing what I have in possession. I've never had that before, Briggs, so I was really happy to hear that. And communities bringing their livestock, and because they wanted to find a way to contribute towards the creation of feeder schools so that their kids can access education, and eventually bringing in the county leaders to come and open some of those facilities. And that pushed the county leaders to begin to invest more resources. And this worked for health and for education, getting dispensaries at the very remote places and getting those very basic educational facilities. So there are those indirect initiatives that we would support. But of course, at national level, we get very engaged, especially at certain policy levels that affect an issue like education, which is very much at the center of community life, livelihoods, or even what can we do so that we influence a better philanthropic space. I think these are just some of the ways that we end up supporting. And I think one of the things that I implied in my earlier bit is that for an organization to be able to rise up in a bad situation, incorporating the organizational side in the support becomes important. So you know, when you support COCOs, when you support them to have good governance, when you support them to run a credible institution, and then you deliberately support them in learning how to raise local resources for those things that they're finding important. That way you capacitate them to be able to push advocacy as one of those things that they care about and they would like to support. So in other words, institutional development is so important according to our experience in helping organizations be able to put some of the resources into an area like advocacy. It may not be easy to kind of talk to people about advocacy in the way that maybe we speak to, but if you bring it down to very practical things that the community is experiencing, that becomes an issue. Of course, I mean, an issue that they can pick up, and in the process, they end up touching on those things that touch their lives, livelihoods, education, you know, could be groups, youth. How do you influence the allocation of resources for an issue like that? So the connection of the organization and the local communities becomes at the very core. And I can confidently say, even at the level of KCDF, riding on that same spirit where you are then looking at what do you do so that you create, somebody's talking about reserves, you create savings. Savings is what might get you to a point where you can have reserves. You may not fundraise for reserves, but you can organize and order your institution such that you have savings which allow you to end up with some reserves eventually. And I must say it is from things like that that at KCDF we've managed to push to a level where we've considered what are those alternative things which allow us to stick to our agenda and not feeling like we must stick. I mean, we must only think about international funding. We deliberately know it's so important to be able to do those things that we value. And sometimes funders may not give you the money for everything you value. But if you work and do your savings or do your alternative investments, finding an office, for example, which is something we have done, so that you are able to plow back your money for rent, which you might get for some of the programs, into your endowment or into your reserves. I think those are some of the ways that we found very, very important in allowing us to create the flexibility we need to put money now to the same CBOs I'm talking about. Exploring different investments that anyone would go for. And sometimes I ask myself, what do ordinary people do? And ordinary people will invest in land, they'll invest in buildings, they'll invest in shares. And we have tried to keep that sort of a lens. And as I was reflecting about this, I realized we as nonprofits have to push ourselves to also think like business people about our organizations. And when we do that, we will know how important it is to be prudent and to observe what opportunities do you have. Can you buy a plot? And we've actually gone ahead and done that. What those things over time is the vehicles that you use to create opportunities for now being able to eventually buy an office, maybe build a rental property, which we have done. Consider other avenues of investment, including, of course, trying to work towards an endowment. It's still a work in progress. And all that going hand in hand with a continuous local fundraising, whether it is an event or doing one-to-one. For me, advocacy falls within that because it is part of what you value as an organization. So you wouldn't be saying that you are raising money only for advocacy. It is looking at your institution broadly and trying to say, what can I do? Where am I? What advantages do I have? While I have this funding for this, how can I ride on this to create streams of income that I can save and begin to see which is the opportunity that I can ride on to create some flexibility, some reserve, which then I can ride on. And advocacy becomes one of those things that you end up supporting as you go along. I think I'll pause there, Bheki.
Thank you, Janet. When we come back, maybe towards the closing remarks, there are some questions that were put here, and I thought you are best to respond to them. Some of them we have already touched on already, but let me just read them out for you. One is how can we encourage our people in Africa to cultivate the habits of giving to charity? The second is how do we build resilience on local philanthropy? I think the questions are more or less related and the same. And the third one is how can we enable well-established organizations to support the sinking organizations as a result of this pandemic? So if you could find a way of responding to those, I think some of the points you have already raised, but when we come back to the closing remarks, I would appreciate if you responded to some of those. Let's go to Briggs. Briggs, I think you addressed a lot of what I'd wanted to ask, but your work as Trust Africa is mainly on areas of governance and democratic development. I think you have already described the funding situation today for your work as a result of COVID. I'd wanted you to talk a bit about that. But what would you see as the emerging key advocacy issues? Some you might have supported already, but others might have come about as a result of COVID-19. And there's a question here that says, what are the different advocacy initiatives that one might think about for COVID in an environment of armed conflict? I'm not by any chance suggesting that you live in an armed conflict environment, but I think your work across the continent and in Zimbabwe might give some, the person who has asked this question some ideas on what are the different areas to look out for and what initiatives can be put in place to develop advocacy during this time of COVID. But I'm also interested to know from you what you see as the role of African philanthropy and foundations like yourselves in developing alternative sources of funding for advocacy in Africa. Briggs.
Thanks, Bheki. I think for us, when we think advocacy, it's about shaping the future we want for Africa. We are using the language of building forward better. There's been a lot of talk of a return to normals. And from where we are standing, we are saying that we have seen that what was there was not normal, and we don't want to build back better, as others are saying, want to build forward better. And the future that we want for Africa is a future that is defined by equitable development. It's a future that is defined by human rights and participatory democracy. And it's a future that is also anchored on African resources or African philanthropy. So those are the three broad thematic areas that we are working on. So we are really invested in conversations about the post-COVID development agenda for the continent. And it touches even on things around, trade. It touches on issues that I raised earlier on around domestic resource mobilization and the various things that I've already touched on. And when you ask about the funding situation on the continent, including the experience that we have seen, I think we've seen great examples of philanthropy, including some of the very grassroots local work that Janet has cited, and the work that we are also involved in. But you continue to see that there's an inadequacy of resources. And secondly, the funding is not flexible enough to be able to respond to emerging issues. It's almost funding that is designed for mechanical social change process when we have very organic and very dynamic processes, emerging on the ground. And I think it's also important to mention that you are seeing that the funding, again, is not sufficiently structured to flow to community collectives and to flow to social movements. If there's one big lesson that we have learned over this period of COVID, is actually the fact that community is one of the biggest resources, if not the most reliable resource of all time. I think as Janet was saying that they had to first and foremost resort to relationships that they had established to really get a sense of what is on the ground and what is needed, and create the legitimacy to even seek support and invest in that. That's our experience as well, because in an environment of a lockdown, you are seeing that it only became your local community that could actually come across and realize that there's a family next door that their livelihood is severely threatened because they were a daily wage earner. It is community that could deal with issues to do with information, because in a situation where there's no trust in terms of government institutions and all of that, if there's communities that were questioning the reality of COVID, and as we are seeing even right now, questions around vaccines and stuff. So community was that resource that could bring about, or that had trust capital that could allow you to be able to, communicate genuine information and all of that. And I think we are seeing a challenge there where there's not enough investment in community, in relationships at the most local level that can kick in and address the weaknesses that we have seen in terms of central government, in terms of formalized responses. So yeah, in terms of our lessons, community is the answer. And when it comes to ourselves and what we've called the future of the future of our funding and of our partners, I think one of the things that has really been validated for us during this time is the issue that, again, Janet mentioned earlier of thinking about sustainability. We were able to do an initial emergence support response based on our own reserves, our own funds that we have built over the years. So these are funds that were unrestricted, funds that we could use the way that we wanted to use them. And whilst the wider funding landscape was adjusting to the new reality, we're actually able to support emergency responses in Senegal, support community responses in Zimbabwe, just as a way of proving a certain concept, and then being able to mobilize greater resources around that. So I think the future is around local resources. Unfortunately, you've not seen adequate response, I would say, from African high net worth individuals yet. And one of the questions that has been asked in the chat group is there to say, how do we encourage Africans to give? I think what we need to think of giving beyond money, because when you say community is a resource, the giving that we are seeing there is the giving of someone walking from one end of the community to the other end of the community, checking on people. This is a child-headed family. This is a family that has a problem. So there's a giving of time, a giving of support, a giving of non-financial means that I think needs to be acknowledged and validated as a resource. But in terms of the bigger strategic questions, we really need to look at how do we build coalitions, how do we build movements for African philanthropy. The example I gave earlier on collaborative fundraising, Trust Africa, African Philanthropy Network, Southern Africa Trust, and how that resonated and was able to get us to mobilize more than maybe we could have done individually. And let me just mention one other thing, Becky, in terms of emerging issues that we think are critical, and this is the issue of well-being. So there's an issue that we have not been focused on historically, but during this period of COVID, it emerged as a central agenda for us internally as a team. Having to actually hold well-being seminars, but also externally, beginning to think about, the question of well-being and community health, and maybe it's, adequate or fair for me to close on the point that it's actually one of the areas that Trust Africa, consistent with our mission to respond to most pressing challenges. It's an area that, we are seriously looking at crafting a very solid response. So let me leave it at that. Thank you.
Thank you, Briggs. We really press for time now. I want to go quickly to Ndifreke. I think you had kind of answered a lot of issues that I had wanted to know about. What are your plans for the future in terms of the key advocacy areas that you are likely to support in the post-COVID context as an indigenous grant maker, but also how your funding was affected. But I think a lot of that you have addressed. So there are some questions that have just come up here, which I think are important for you to reflect on. One of them is how has African philanthropy distinguished itself from northern donors during this pandemic? And you are one of those local philanthropists. Could you speak to that? And then the other question has to do with how donors can support the urgently needed transparency on national COVID budgets. I mean, if you note, you know, in almost each and every country, there's a lot that goes unaccounted for in terms of how the COVID contributions have been managed by our government. So I think the question is, what role can philanthropy play there? And also the third one, if you have time, is how can the private sector be requested or be prompted to finance civil society initiatives? So there are a lot, but if you could just give your short answers so that we can close on time.
Okay, so I would answer as I remember the questions. And if I missed anyone, I'll try and answer on the chat box, so I do not take too much of our time. So as a foundation, and then given all the research we have read upon and even the research that we did ourselves, there are three areas we are going to be thinking about very critically when it comes to our plans. When we look at advocacy and we look at the civil society organizations, one of the areas is digital transformation. And we see that is a huge part for us, because one of the questions that we had asked during our research was, what would you like the donor community to do differently? What are the areas of need? At least three areas. And the three that came up most highly rated were capacity building on the use of technology. How do they transition effectively to using technology? Sometimes we feel, oh, we know how to use technology, we know the platforms to use, but there are so many tools that are available that we haven't explored, that we're not even aware. One of the trainings that we had during our breakfast dialogue was on tools that were available for nonprofits to use. And there's so many free tools that you could have legal support for free. There was an online platform that you could put your legal consent, and you could provide support. Slack and Zoom, even Zoom that we think is so easy to use, it has so many things that it can do. So we realized that we need to focus on how we can provide those skills. How do we support organizations to use technology more effectively? So that's an area we're going to be considering a lot. And even something as simple as internet access. It was so important to a lot of these organizations, because now their costs increase. We're still paying their rent, still paying their light bills, whether they were there or not. Some of them are paid in advance for a year or 2 years. That bill was still there, but now their technology costs increase, right? So we need to do something differently about that. The second thing we want to do differently is in terms of climate action. And for us, that is important. We have seen from just locking people up in their houses that there was a lot of improvement. You see videos online of more animals coming out from different places that they were in, and how their habitat just benefited from the human effect, of us doing the usual things that we do every day. So we know that climate action is very important. We're going to be working on that a lot more in the coming years. And then gender-based violence, that for us is top priority, or second top priority for us. We realized that during this lockdown, because we fund gender-based violence initiatives already. And to be very honest, when we talk about philanthropy, lots of times we put the problem on philanthropists. I've worked in not-for-profit organizations that were implementing organizations. And I've had the opportunity to now speak from the funders. And I think we put a lot of the challenges that we face in the sector on not having resources. But I find that when you look at generally across the sector, reports that have been done, you find that when it comes to advocacy, we have not been able as CSOs to find a way to report impact more short term. So changing policies and all of that is long term. It will take several years of doing something consistently and putting certain things in, particularly for the younger organizations, for you to get to that where you are able to change the policy or contribute to changing the policy. But have we been able to break it down into bits and pieces of, at this level, this is where we are going to get to? That ties in a way that the donors can understand it. The initiatives that are funded, you find that it's easier to fund initiatives because in 5 months, in 6 months, you can get results. In 3 months, you can say, oh, this is the outcomes that we can get out of this. Funders also have people that they report to. They have to be able to defend how they use the fund, right? So if advocacy organizations are not able to show that clearly, right, you would find it difficult getting buy-in. And this I'm saying from the perspective of that we need to be thinking innovatively as CSO organizations to ensure that we get funders on board to better understand. We fund some gender-based violence initiatives here in Nigeria. And when we talk to the organizations, we hear some of the feedback during this time. It's really scary. The lockdown cost increased the level of gender-based violence significantly because a lot of people were locked in. Children were all with the perpetrators, you know, the women were there. So it was really bad. But the organizations that were implementing did not have advocacy skills that they could use to take this to the next level. And we started saying to ourselves, how do we create that collaboration where those that have the advocacy skills can partner with, because we knew that it could not just be initiatives anymore, right? We had organizations that were training the police force to better handle the issues, training traditional birth attendants that when they get these issues, they don't just hide it because, oh, it's disgraceful. When you hear that a parent molested a child, you know, families are hiding those things. And when it's being reported, the police treat it as if it doesn't matter. And say, oh, what were you wearing? You know, all of those sort of things. We knew it had to go to the national level where there are policies that are protecting the vulnerable in our communities. But the organizations implementing do not have the skills to take it to that level. So they are consistently doing the work that they can report, and these are the outcomes, right, that we want to be able to see. So if that partnership can happen, you find that funders will find it a lot easier to fund initiatives that have advocacy or policy change tied into it. So that's one of the things that we want to be able to encourage, given this conversation. Another thing I would like to say very quickly, I know Bheki wants me to, but I'll quickly say.
Before you proceed, I just want to check. I just want to check with Irene whether we should take more time. I see she's asking delegates for an extra 10 minutes. But given that people had planned around this, I would want us to not take too much of their time. So if you could make that short intervention, and then we do the closing remarks.
Okay. So I'll just give a few thoughts on things that I think that we need to do differently as civil society organizations and not-for-profit organizations that we have seen as from the funders' perspective, that if we were able to align, to give us, it will help us to be able to provide funding for the sector a lot more. Engage us. A lot of donors do not understand advocacy as well, right? Those that are funding it already have an understanding. Some people don't, particularly because a lot of philanthropy in Africa is private sector coming from banks, private sector manufacturing, they're just doing their own CSR as far as they're concerned. That is what they want to focus on. Invite them to your conversations, bring them on board. Those people you are targeting that you want them to support your cause, bring them on board. Use social media, create a polling system. You found something is happening, bring more people to talk about it. In Nigeria, we had the NSAS protest that happened in October of 2020. And you won't believe the amount of support, funding support, that groups that were pushing for ending police brutality in Nigeria received from the diaspora and from different organizations. How do we leverage such opportunities? It cannot just be do the research, find out what is happening, and then push it to the elected leaders and say, how do we change this? Let us get the voice of the people involved. And the people, the grassroots people you're trying to reach, they're not just going to listen to you, get the feedback. They want interventions. They want quick solutions to their problems. Let's bring all of this together. You'll find that you have more opportunities for funders to come on board and fund advocacy, because it's too important. And we have to think outside the box on how we can get more funding for the sector.
Thank you very much. I think there's just a lot for us to talk about, and I'm happy that the organizers have not just thought of this particular webinar, but there's a series, and so there will be the next webinar that might take the discussion forward. I noticed that in the program, there's going to be a poll, and I suspect, Irene, this could be the time to run the poll. Meanwhile, as we run the poll, I would ask the panelists to give 1 minute each, please, just to give your key message that you want the audience to take home with. So there are many messages that I think you have given, but what is that one message that you want the panelists to take home with? Let's start with you, Janet.
Yeah, Becky, sometimes it's hard to know which is this one thing, but what I would say is based on most of the questions you had posed, I think for those who are grant makers, let's invest a bit of time in passing on skills that help draw the sustainability aspects of whether it is our own organizations or grassroots organizations, so that we don't wait for a crisis to figure out whether we are going to survive or not. So fundraising skills, local fundraising skills are slightly different from institutional funding skills. And unless we invest in understanding our context and what works in this particular context, we will continue to struggle. And I believe if we stabilize our institutions, then we will be able to find ways of creating resources which we can put to advocacy among the other bits of work that we want to. I think that's all I may have time for, but more important also, let's communicate about our work. We complain about not being funded locally, but we are very keen on accounting to international funders, but we are not as keen in ensuring that the people around us know what is this very impactful work we are doing, which we want money to be given for. What did you do? What are those human rights issues you saw in the prison? Do the locals around you know, apart from the reports you have given to the international funder? Why aren't we communicating that so that people can see why it's so important to stamp out the things that are happening in our countries that should not happen? So let's invest in communication, in growing the skills, in growing accountable institutions which have legitimacy, and we will be able to raise the resources we need locally as well as internationally. Thank you.
Thank you very much, Janet, and thank you for the great work that you are doing at KCDF. I can attest to that. I've traveled the journey with KCDF and yourself in particular. We really appreciate the service that you are doing for the region and Africa as a whole. Briggs, let's get back to you and hear your key message that you want the audience to take away with.
For me, Becky, I think it's affirming that philanthropy is an important source for development finance, and African philanthropy is the future in terms of resourcing our development agenda on the continent. I think we also need to be paying attention to issues to do with the environment. It needs to be made much more conducive, the legal environment, the political environment, and the fiscal environment. If our leaders are paying attention to how the continent is faring right now, they would appreciate what a critical resource philanthropy is. They'll appreciate what a critical resource civil society is, to the extent that, when you say you only are going to allow essential services to operate, you need to look at how do you include philanthropy actors as well as civil society actors in the process. I think the other thing that I would also mention is a I think for us as people in the philanthropy field to be creative. I think they say necessity is the mother of invention. We've seen ourselves being pushed to be inventive in this period of COVID. If you've been checking the news, the past week, Trust Africa has been distributing K95 PPEs in Gambia, in Senegal, to support frontline workers, who are facing shortages with, such a basic and essential resource in the response to COVID-19. And this is a result of, us creatively structuring partnerships with private sector manufacturers of these resources. And we've distributed over 30,000 of such, PPEs. So I think it's a call to be creative, and it's a call for us to do all we can to ensure that we fully realize the potential of African philanthropy in driving the continent's development agenda. Thank you.
Thank you, Briggs. Before I go to Ndifreke, can I just urge those who are still around to vote? I see the polls are very slow compared to the numbers that we have. Your final takeaway message, Ndifreke?
Thank you, Becky. So I think I would concur with Janet and say communication is very key. Simplify the information. Not everyone is going to read the voluminous document, but you need to carry the public along, the donors. If they say they do not know, and I can tell you that that's the conversations that is really being had with African philanthropy. Let's educate them. Let's get them to understand the work you're doing and see how important it is, so that we can access funding for the sector. And finally, I want to encourage that we collaborate more. Let's find opportunities to collaborate. We can't do this ourselves. We can't change the world ourselves. We can't change Africa ourselves. Let's partner. Let's work with other civil society organizations and nonprofits that are doing similar work or that can help us drive the change that we want to see in our different communities and countries.
Thank you very much. And thank you all the panelists, Janet, Ndifreke, and Briggs, for taking your time and sharing your insights on this important topic. By no means have we exhausted the insights by this webinar. I think that this is just the beginning of the needed conversations we must have in Africa in order to support the different forms of advocacy that already existed and those that are emerging as a result of the COVID-19 pandemic. So from what we really gathered from this conversation is the importance of community. I have always argued in the different writings that when our different countries adopted different measures to fight against COVID-19, in the beginning, they did not think of the community. Only later did they realize that even if they had all the scientists and the resources at their disposal, without the community's engagement and involvement, the fight to defeat COVID-19 was not going to succeed. And so community is very, very key. Secondly is the importance of relationships. And I think that the insights from Janet and everyone else are a testimony to what relationships entail and how important it is to actually have these relationships. They actually come to the assistance of many groups at the time of crisis. I think the third related to that is the whole issue of collaborations. No one entity can respond to COVID-19 or any other societal challenge that is affecting our different countries. And so COVID-19 is not the last pandemic that we are going to have. There will be many more. So how do we use this opportunity to prepare for the next pandemic? And collaborations are going to be very, very key. I think the issue of well-being, we have focused on the technical sides of things and forgot that the human beings who are involved in responding to COVID are actually affected and their well-being is important. So even as our own individual institutions, what do we put in place to make sure that the well-being of our employees and that of their partners, that of their families, that of their relationships are actually taken into account? And then there's the issue of being creative and innovative that I think is very important. And this is in all forms, whether it's in regards to domestic resource mobilization, in being able to pivot to new ways of working, to new areas of advocacy as the context demands, or to basically finding creative ways of creating new relationships in a short space of time. So I think there are a lot of insights that we gained here. The recording will be available, and so we are all able to take a listen one more time and be able to decipher those important insights that have come about. So from my end, Irene, I would stop here and thank the panelists, thank the participants, and thank you, the Advocacy Accelerator, for convening us to have this discussion on this important topic. So good afternoon, good morning, and good evening, depending on where you are. Enjoy the rest of your day.
Thank you, and goodbye.
So yeah, so I think that's where it ends. Goodbye, everyone. Claire made an apology that she won't be able to make the closing remarks. So I'm closing on behalf of the Advocacy Accelerator. Thank you, everyone.
Thank you. Bye.